Assalamu alaikum. I'm Dr. Talha Shafiq and you are watching Pakistan Veterinary Education. Today I come up with a new topic in radiography of the skeleton system. So in this session we will discuss about the X-rays of the joint. So before starting we should remember that there are some parts of joints that are not visible in radiograph, and these parts are articular cartilage, synovial fluid and the joint capsule. In case of young animal, joint appear much wider as compared to the adults. This is an important identification by which you can identify the animal age on the basis of such signs. This one is ossifying epiphysis. That is just an irregular outline, and this is normal thing. And please don't consider it as any type of abnormality. This is normal ossifying epiphysis in the joints. Now, if we talk about the common joint problems, that may be laxation or dislocation of the joints, it may be osteoarthritis or osteoarthrosis, and septic arthritis. Similarly, developmental joint problem includes ununited and conial process, that is also known as elbow dysplasia, then hip dysplasia, then congenital laxation of the patella, and bipartite sesamoids. Let's start from the common joint problems. Uh, First one is laxation or dislocations. Always remember, you have to take two views at right angle that are very necessary for proper evaluation of degree and direction of displacement. Here in this radiograph, you can see the hip joint. This one is the head of the femur, and that articulate with the acetabulum, and this is normal joint. No, you can see here displaced or laxated hip joint, and the head of the femur is displaced craniodorsally in this case, as you can see here. So this is a clear example of the dislocation or the laxation of the joint. No, the second one is osteoarthritis. So I want to clear that it is inflammation of the joint that may lead towards the degeneration, and the degeneration of joint is technically known as osteoarthrosis or degenerative joint disease. This osteoarthrosis is more common than osteoarthritis. Osteoarthrosis may develop due to any advanced aging, any type of injury, or any condition that put excessive stress on a joint. In simple words, it may be secondary to a primary joint abnormality. For example, osteoarthritis developed due to hip dysplasia, which may further lead towards the osteoarthritis. In case of hip dysplasia, you know that there will be irregular articulation or friction between the joint surfaces. So it may cause osteoarthritis, which may further lead towards the osteoarthrosis. In this X-ray, you can see the normal stifle joint of a dog. So in the next radiograph, you will see the radiological signs of osteoarthritis. So the number one is you can notice lipping of the joint margins. Lipping means irregular margins of the joint. Second one is sclerosis of the subchondral bone. Here you can notice the signs of the sclerosis. The third one is whenever there is osteoarthritis, joint spaces decreases due to inflammation. In this radiograph, you can notice here that osteoarthritis causes inflammation, and so the space between joints decreases. Sometimes cystic areas may develop. That is not very common, however, it may occur in some cases. Due to inflammation, normal joint articulation will be affected. That may lead towards the subluxation or some or laxation. Now, next is septic arthritis. This is also arthritis, but there will be septic wound or history of the wound. It is not common in dogs and cats. However, cats are more prone somewhat as compared to dogs. Usually, it's a sequelae of a wound. Mostly, cat bite or accidental wound lead towards the septic arthritis. So this is a radiograph that clearly shows our radiological signs of septic arthritis. Notice you can notice here that joint spaces are going to be wider due to erosion of the subchondral bone. While in case of osteoarthritis or osteoarthrosis, the joint space become narrower. In this case, you can see that there is increase in the joint space. It becomes wider. That is due to erosion of subchondral bone. Irregular bone edges due to osteoarthritis. You can notice that there is irregular bone edges due to degeneration of the bone. Sometimes there will be osteomyelitis in the affected bone, but in this X-ray, osteomyelitis is not present. Now come towards the second part of the video, that is about the developmental joint abnormalities. Ununited anconial process, that is also known as elbow dysplasia. This is very common in the large breed dogs and frequently seen in the German Shepherd. Listen to it very carefully that elbow dysplasia and the hip dysplasia are very common in large size dogs. Radiological procedure to show the anconial process, you have to take the radiograph in extreme flexion with mediolateral view. It means that you put the animal in the lateral recumbency of the affected site. The primary beam of X-ray enters from the medial side and it will exit from the lateral side that is in contact with the X-ray cassette. So this will be called mediolateral view. These are the normal X-ray images of the elbow joint. This one is in the normal position with no extension or flexion. No, this is a radiograph which is taken in the extreme flexion where you can clearly evaluate the anconial process. This one is anconial process of the ulna. This one is radius. This one is ulna with the anconial process, and this is distal extremity of the humerus. Now look at this X-ray image. You can see the humerus that is very clear. Radius also have no any type of abnormality. While if you look at the anconial process of the ulna, this is ununited anconial process. So this is a clear case of ununited anconial process or elbow dysplasia. I hope so that this is now very clear about the elbow dysplasia. Developmental joint abnormality, that is hip dysplasia. This is also very important developmental bone abnormality in dogs. This is hereditary and related with the large breed dogs like German Shepherd, like Labras, Rottweiler, and extra. Come towards the radiographic procedure. Always remember to attain proper position. You have to sedate the dog. Without deep sedation, it's not possible to attain proper position. After the sedation, bend the dog dorsally with the hind legs drawn out behind. Now you have to grasp the hock joint and extend the limbs and rotate inwards. This all enables the patella overlie the femoral trochlea. It also helps inward rotation of the femoral neck to be clearly seen. Other precautions during radiographic procedure are pelvis should be parallel to the tabletop, and you know that definitely wings of the ilia should be equidistant from the table for the proper alignment. If we talk about the hind legs should be parallel to one and each other. and in such a way that the medial cortex of the femur overlie the corresponding ischial tuberosity. So it's very important to know that if the patient, I'm repeating it, if the patient object or the patient part that we have to take in the X-ray image is more than 10 centimeter thickness, so we have to use the grid for the proper X-ray image. Otherwise, the X-ray radiations will be scattered and the image will be blurry. Images will be not very clear. After taking the radiograph, let's come towards the radiograph or the X-ray image reading. This is the most important segment of this video, so listen it very carefully. First, you have to check the wings of the ilia. Both wings appear symmetrical. Then obturator foramina should also be equal in size and symmetrical. If these are not equal in size, then pelvis rotated during exposure means that the alignment of the pelvis was not aligned. Patella should overlie the femoral trochlea. This is important because before evaluating the hip dysplasia, all these signs for judging the proper symmetry or proper alignment of all joints and proper positioning of the animal is very essential before evaluating. Now, if we talk about the proper hip joint, you will notice femoral head will be even and rounded. So, what are the signs of the hip dysplasia? Number one is femoral head fits poorly in the acetabulum. There may be subluxation or the luxation of the femoral head. And if 50% of the head is outside the acetabulum, subluxation is present. Basically, subluxation can be assessed by a method that is called Norbeck's method. So, what is Norbeck's method? According to this method, angle formed between line joining the centers of the femur. This is the line that basically join both centers of the femoral heads, and a line joining the center of the head with the cranial acetabular rim on the same side. This angle should be less than 105 degree. Here in this X-ray, you can see that in the left hip joint, angle is 92 degree. So this is a case of the hip dysplasia. Now, if we talk about the secondary degenerative changes that may also take place, it may be irregular femoral head. Acetabulum also becomes irregular, and there will also increase density on the femoral neck due to new bone formation around the acetabulum, femoral head, and the femoral neck. There will be also signs of the sclerosis due to new bone formation on the subchondral acetabular edge. The third one is congenital luxation of the patella. In craniocaudal view, patella is on the medial side of the femur in the medial luxation, and its lateral displacement is very less common. This is normal knee. In this X-ray, this is fibula, and it means that this should be the lateral side, and this one is medial side, because we know that fibula in the stifle joint, tibia is on the medial side and the fibula is on the lateral side. So we can identify the sides on by remembering the location of these bones. In this radiograph, this is patella that is luxated on the medial side. Ideally, it should be there. So this is a clear example of the medial luxation of patella. No, the last one is bipartite sesamoid bones at metacarpopharyngeal joint and metatarsopharyngeal joints. As you know that these are numbered from 1 to 8, and the numbering is always started from the medial side to the lateral side. Bipartites are usually second and seventh. This developmental anomaly should not be mistaken for any type of fracture. You can see at this X-ray that bipartites are at the second and the seventh one. So this is all about the joints. If you have any question, you can freely ask in the comment box. Please like the video and subscribe our channel for more informative videos and support us. Stay blessed. Allah Hafiz.